when you get injured, so if I bang my elbow, if I fall onto my arm and I injure my wrist or my elbow, your brain is smart enough that it knows it needs to protect that area. And so what it does is essentially sets like a dimmer switch on the muscles in that area. And that dimmer switch isn't here, it's actually up here in your motor strip, in your motor cortex. And so we call that inhibition. So when you strain or injure a tissue, your brain knows it's in its best interest not to allow that area to move freely or move as maximally as it could before the injury. So that dimmer switch is there, it's called inhibition. So I've developed a series of exercises to address that, to reset the motor cortex. And so in this video, I'm going to teach you one pattern. And the challenge was, well, what one pattern would I give, the majority of my patients, or if I could only give people one pattern? And I thought about it long and hard, and I chose this pattern because it's related to walking. So this is the first corrective posture. So what we're going to do is you're going to start arms length away from the wall with your feet situated underneath your pelvis, underneath your hips. From here, Nico, what I want you to do is just shift both heels back about 4 to 6 inches. And it's important that you look down at your toes right now and just make sure that they're pointing straight ahead. Now there's a tendency when we shift back that your back's going to want to sway and move towards the wall. You got to fight that sensation, so you can't give way here. Now go ahead and move your hands up the wall 4 to 6 inches. Your elbows will be straight. And this is to induce a trunk lean. So now it's important you keep your back straight. Now go ahead and make sure your knees are straight and locked. And then from here, without changing the position of your knee, without letting your back sway, we're going to start to press into the ball with both feet. And you'll feel your heels want to rise maybe half an inch off the ground. And then keeping your knees locked, really maintain that pressure, but don't let your heels rise like you're doing a calf raise. Maintain that same height. So now you should feel like your heels are kind of levitating. Your back is basically not going to move, and you're pressing the ball of the feet into the floor. And you're holding this posture for 20 seconds. So it's a complete 20-second hold. I can't emphasize how critical it is that you hold it for 20 seconds. I would highly recommend you get a timer. Okay, and then you relax, okay? So then, Nico, what you can do is you're already in the right posture. You don't have to move. And so from this position, find your back brace again, kind of tighten up your abs, lock your knees. And as long as your toes are straight, start to press into the ball of your feet. You'll feel your heels rise just a little bit, but you're keeping that pressure into the ball of your foot. It's not like doing a calf raise. So we're going to do 6 reps of 20 seconds of this pattern, and then we're going to come back and reassess Nico's deficits.